Hello everyone and welcome to this short lecture of the topic of STEMI. And today we are speaking in this short lecture about a very important topic that we see in our practice, which is transient ST elevation. Of course, we are going to learn today what's the clinical significance of transient ST elevation and when we diagnose the patient as having transient ST elevation. We remember this definition, of course, from the last two lectures, but there is an important point that when we define STEMI, it was an important part of the definition, which is persistent ST elevation. In order to decide this is STEMI, of course, the ST elevation will be persistent because it is a coronary artery occlusion with a thrombus in most of the cases. So it is persistent ST elevation. But sometimes the ST elevation may be just transient, as the patient may present with typical chest pain and ST elevation in the ECG leads like in the anterior leads or inferior leads. And when he is referred from another hospital for primary PCI, for example, the patient went to the ER of a hospital without primary PCI service 24/7, and so the decision was to transfer him in an ambulance car to another hospital with primary PCI service 24/7. And when he reaches the second hospital, he was chest pain free. And when he had a routine ECG when he arrived to the ER, for example, his repeat ECG showed no ST elevation. And so it resolved spontaneously, and this is not STEMI. In this case, it is considered high risk non-ST elevation acute coronary syndrome rather than frank STEMI. And sometimes we call it stuttering course, especially when this pattern is recurrent, not just once. For example, in this ECG, this patient was having ST elevation in inferior leads and he was having chest pain. And when he reaches the second hospital, the ST elevation resolved completely, and so he had no pattern of ST elevation in the second ECG, and the ST elevation in the inferior leads resolved completely, and the patient was chest pain free, and so we consider this as transient ST elevation. Of course, transient ST elevation, as it is considered high risk non-ST elevation acute coronary syndrome, the patient will need early invasive strategy within less than 24 hours. But if the pattern of transient ST elevation was recurrent, for example, the patient was chest pain free and the ST elevation resolved, then he had another bout of chest pain with new ST elevation. In this case, we consider it as recurrent, and the patient in this case should be referred for urgent invasive strategy, the same as primary PCI, because this patient is having a stuttering course and he would turn into frank STEMI. So remember, presence of transient ST elevation in clinical practice doesn't mean that we perform follow-up ECG for a patient with frank ST elevation. I don't mean this, of course, because some people may suggest that in order to define STEMI, we should have persistent ECG ST elevation in ECG, so you would have two serial ECGs. This is completely wrong, and just ST elevation one ECG is enough to go for primary PCI. But some cases when the patient is referred to another hospital and he became chest pain free, we may decide to repeat the ECG and the ST elevation resolve. So follow-up ECG sometimes is performed in case of transfer, and it may show evidence of complete resolution of ST elevation, suggesting that this was transient ST elevation. And so go directly for primary PCI without any delay if you just detect ST elevation in one ECG without follow-up ECG. Of course, some clinical conditions are not considered transient ST elevation, so you need to remember them in order not to treat them as transient ST elevation and omit the primary PCI service. For example, the patient has improved ST elevation with reduction of the ST elevation but with still residual elevation. The ST elevation didn't resolve completely. Or some patient may have persistent chest pain despite resolution of ST segment elevation. So yes, the ST elevation returned to normal, but the patient is still in chest pain. In this case, the patient should be considered as a STEMI and go for primary PCI. So in order to consider it transient ST elevation, the patient should have complete resolution of ST segment and also disappearance of chest pain. And so this is not very common to see these two conditions, and so in most of the cases you are still going to deal with the patient as STEMI. So at the end of this short lecture, we remembered, or we learned today, the clinical significance of transient ST elevation and when do we diagnose it. And our take-home message: transient ST elevation is only diagnosed by coincidence rather than we wait till resolution of ST elevation in order to decide whether it is transient or persistent, and it indicates high-risk non-ST elevation acute coronary syndrome rather than STEMI. Thank you very much for your watching.